Bismillah Rahman Rahim. Assalamu alaikum. Welcome back to the channel. In today's lecture, we shall be discussing the risks and complications of fasting during Ramadan for individuals with cirrhosis. While fasting has spiritual and health benefits, it can pose serious challenges for those with liver disease. We shall explore how cirrhosis affects the body's ability to adapt to fasting, the potential risks involved, and important medical guidelines to ensure safety. Stay tuned for expert insights on managing cirrhosis during Ramadan. Section 3 of our workshop, Risks and Complications of Fasting in Liver Cirrhosis. These are the 5 sections of our workshop, and today we shall cover section 3, 4, and 5. Section 3 of our workshop, that is the risks and complications of fasting in liver cirrhosis, has 4 main aspects: dehydration and electrolyte imbalance, hepatic encephalopathy, variceal bleeding, and worsening liver functions during Ramadan fasting. The first component, that is the dehydration and electrolyte imbalance. Individuals with liver cirrhosis are at increased risk of dehydration and electrolyte disturbances during fasting. In the previous video, we discussed the physiological changes in a cirrhotic patient, and in keeping that in view, now we are discussing the impact of fasting on physiological aspects of a cirrhotic patient. So individuals with liver cirrhosis are at increased risk of dehydration and electrolyte disturbances during fasting. This can lead to complications such as hepatic encephalopathy, variceal bleeding, and worsening liver function. The second component is the hepatic encephalopathy. Fasting can exacerbate hepatic encephalopathy. It's a complication of liver cirrhosis characterized by cognitive impairment and altered mental status. The third challenge is that of variceal bleeding. Fasting can increase the risk of variceal bleeding, a life-threatening complication of liver cirrhosis. We know that. And the fourth is the worsening liver function. Fasting can worsen liver function in individuals with liver cirrhosis because the liver functions are already compromised in cirrhotic patients, particularly those with advanced disease. Section 4 of our workshop is the precautions and recommendations for fasting in liver cirrhosis. And here We will discuss the pre-fasting evaluation of cirrhotic patient, hydration and electrolyte management in such patients, managing, monitoring and follow-ups during Ramadan, and alternative fasting options. Pre-fasting evaluation is important. Individuals with liver cirrhosis should undergo a thorough pre-fasting evaluation, including assessment of liver function, electrolyte levels, and overall health status. Child peak and MELD scores are very important to determine the severity of cirrhosis, and they should be calculated. Hydration and electrolyte management. Individuals with liver cirrhosis should be advised to drink plenty of water and electrolyte-rich fluids during fasting to minimize the risk of dehydration and electrolyte disturbances. So, from iftar to suhoor time, if they are fasting, then they need to take care of their hydration and electrolyte imbalance when they are not fasting, when the fasting hours are paused. So during that, they need to take care of their hydration. Monitoring and follow-up. Regular monitoring and follow-up are essentials to detect potential complications early and provide prompt treatment. So if a cirrhotic patient is fasting during Ramadan, her regular monitoring and follow-ups are essential. Alternative fasting options. We must educate and we must present to them the alternative fasting options. Individuals with liver cirrhosis may need to consider alternative fasting options, such as shorter fasting periods. Shorter fasting periods are exemptions from fasting to minimize the risk of complication. By shorter fasting periods, I mean that they may keep fasting on one day and fasting on the alternate days, so they give the break among two fasts. This is one of the possibility, and the day when they are not fasting, then for that day they give the fidya, or the 1 out of 3 days they fast, and the remaining 2 days they give the fidya, so they can do that way. It is not possible that they fast for shorter time. The fast has to be from the suhoor to iftar, but they can skip the days in that way. This is one of the possibilities. Or if they are unable to fast, then they give fidya with this intention that when they gain the health, they will keep the fast. In compensated cirrhosis, some studies suggest that fasting may be feasible under close monitoring. Regular checkups to monitor symptoms and lab parameters, they are very, very important. To monitor glucose, electrolytes, and hydration. We should emphasize balanced meals during suhoor and iftar, and encourage adequate protein and calorie intake, and adjust medications diuretics to avoid adverse effects, and to assess diabetes, renal functions, and cardiovascular health. All these points we have discussed in our case histories when we were discussing our case histories in our second episode. In decompensated cirrhosis, if a patient is decompensated, it's a strong contraindication due to higher risk of complications, and we should provide a medical report to exempt the patient. This is important that we should give them in writing, and of course we tell them, educate them on the alternative options available. Our religion, Islam, does allow that if a patient is sick or critically sick, he or she may give fidya in the place of fasting. The fifth section of our workshop is the conclusion and future directions. And this is three components. We'll summarize the key points. What are the future research directions and what are the clinical implications? Summary of key points are that fasting during Ramadan can pose significant risks for individuals with liver cirrhosis, including dehydration, electrolyte disturbances, and worsening liver function. Pre-fasting evaluation, hydration and electrolyte management, and regular monitoring and follow-ups are essentials to minimize the risk of complications for cirrhotic patients during Ramadan. The future research directions are that the future research is needed to better understand the effects of fasting on liver function and to develop evidence-based guidelines for fasting in liver cirrhosis. The clinical implications are that healthcare providers should be aware of the potential risks and complications of fasting in liver cirrhosis and provide individualized guidance and care to minimize the risk of adverse outcomes. And this is the purpose of our workshop as well, to enable you to properly evaluate the individuals, the cirrhotic patients' status, and give your individualized guidance to them. The key guidelines for managing cirrhotic patients during Ramadan. This is our next vlog, and this will be the last episode of today's workshops. So what do you want to be discussed in that? Please do share your thoughts in the comment section below, so I include those components in my tomorrow's vlog, and that will be the final vlog on the cirrhotic patients in Ramadan. I hope that what I was trying to share with you, the rationale, the basic underlying concepts, that when we allow a cirrhotic patient to fast or when we advise them not to fast, what is the data, what is the logic, and what is the underlying science on the basis of which we will advise, because without knowing the proper knowledge, this is probably something which may be a guna to allow someone to fast, and if he or she is unable to fast, or tell them not to fast and they can't fast. So this is a very, very important in our religious obligations, and this was my aim, to educate you that how you will advise your cirrhotic patients whether they should fast or not fast. So see you tomorrow in the last episode of our workshops. Till then, take care. Khuda Hafiz.